So 2010 is when I started. In that first 2 years of coming, we met together as a clinical and a leadership team. We defined our mission at that time, and our mission was EnRICH, to assist youth and families in developing excellence in relationship, influence, character, and health. Conceptually, philosophically, that was something that we got behind at the time. The difference now is that it's gone from more of a conceptual and philosophical framework to a competency-based approach. We want families to know that coming in the door here, we're going to focus on those 4 areas, but in a way where we're helping youth and families identify and develop competencies in all 4 of those areas that can not only be helpful within a treatment setting in a community, but also in life overall. That approach will still be informed primarily by master treatment plan goals and objectives. What we're looking to do is to help youth establish competencies in 2 areas. Core competencies that are unique to them, that are driven by the treatment plan. Core competencies that are practiced within a setting like this, that give them practice for the rest of their life in other communities and settings as well. I would say that it's gone from conceptual and philosophical feel-good to an approach that is measurable. We have a way of measuring and going after relationships. We'll have a way of doing the same thing in those other 3 pillars of EnRICH: influence, character, and health, and to do so in a much more rigorous way that is both practical and very applied. They're not assignments. These core competencies are not based on things they have to complete, T's to cross and I's to dot. This has a lot to do with when it comes to, for example, emotional regulation. And we're talking about when you hit a certain stressor with a peer, teacher, parent, therapist, whoever it might be, what's the same or different about how you ramped up the severity of the reaction that you had compared to, hey, this time it was slower and it wasn't as big of a blow within my belly and then also with other people. They're going to be able to see that rather than crossing T's, it's more about, I feel like that's actually a change in behavior or a change in emotion or thinking that's not so easily captured in a worksheet. And so I think they'll find that it feels like I'm making changes, not just completing assignments. There's a lot of use of the phrase relationship-based programming out there. And it's one thing to kind of talk about it, and it's another thing to embed it within your programming, not just clinically, but in terms of interactions with staff, residentially, medically, through our adventure programming, within the classroom, and so forth. So relationship-based, it's relationship-anchored, it's relationship-informed, it's relationship-guided. And part of that also involves not just information about relationships, it's the real-time encounter of person to person. And what does that encounter really require of us? We're working our hardest to help redefine what success really means. Success is not the absence of struggle or problems. It's learning how to do them better with less shame and more confidence that when we hit our rough spots, when we go backwards, or what feels like backwards to us, what we're really running into is something that is telling us, hey, that's an area of struggle or difficulty for you. If you run into an experience that you're having in life, which represents a bit of a sticking point or a hang-up for you, that's good information. Something within you or within your relationships is telling you, hey, this is difficult and I'm having a hard time living life around it. And so what we do is we just pump the brakes, we slow down, and we really try to get clear on what it is that's contributing to that struggle. And then once you kind of start to tease that out and address it, by very nature of how the human experience works, you start to progress again. It's a beautiful thing.